Hi, it's Andrea with Edgar Equine, and I have Frosty with me today. We're hanging out at the hitching post, and we're going to talk about kissing spines. So kissing spines, first of all, we should talk about the vertebrae of the spine. So the vertebrae run from the cervical portion, which is all the way up at the pole, and they go through the cervical, the thoracic region, then we have the lumbar and sacral back along the hind end. So kissing spines primarily is most often found in the thoracic region of the horse between T13 to 18. So it's going to be like the lower back region of your horse. So ironically, where the saddle sits is usually about T8 or 9 to 18. So it's right underneath where the saddle sits on your horse. So in kissing spines, what happens is the dorsal spinous processes, which are, if you run your finger along your spine, you're going to feel the bumps, and that's the dorsal spinous processes. And that's what is along the top portion of your horse's spine as well. So in kissing spines, they start to, instead of being evenly spaced like they should be, some of them will start to tilt towards each other. And in severe cases, they will actually cause bony remodeling and fusing and very drastic problems in your horse's back. So kissing spines are graded from a 0 to a 4. 0 being there's no problem at all. 1, they're starting to kind of tilt towards each other, but they're not actually touching. And then 2, 3, and 4, in grade 2, they are starting to touch, but there's no bony remodeling. You'll start to see the bony remodeling in grade 3, and then 4, it's severe bony remodeling. So there are definitely different grades of the kissing spines. What causes the kissing spines? Research has recently shown that there is no genetic component to kissing spines. However, conformation can play a part in it. If your horse has poor conformation, sometimes that's a struggle that we have that you're going to be fighting against consistently to prevent this from happening. So sometimes that's a cause of the kissing spine. Poor saddle fit is a major problem with kissing spines. Riding your horse with a hollow back, so they're constantly with their back like this, it can lead to kissing spines because they're constantly ridden in the motion that causes those vertebrae to go towards one another. Saddle fit, the hollow back, just poor riding in general, or even imbalanced riding, are all things that can lead to this problem. So the problem with kissing spine is that the symptoms are so vague and can look like so many other things that you really need the x-ray to confirm the diagnoses. But you'll see things like back pain. When you're saddling, they may be angry even when they're under saddle. Sometimes if your horse starts bucking and there's no other reason that you can find, that might be something to look into. You'll see, like I said, back pain, even like the SI pain, and even glute pain can be a symptom of this. They might be stiff to warm up. They can, what else can they do? Stiff to warm up, they could have difficulty bending, they can have choppy strides. Just as you can see, like all these different symptoms that can be symptoms of so many other things, but they're very vague, and they're all things that this should be on your radar if you're seeing those types of symptoms with your horse. So luckily, if kissing spine is caught early enough, there are things that you can do to manage it very well. I have a lot of bodywork clients that do have kissing spines, and they are competitors and they are good at it. Their owners are very mindful of proper riding now, knowing the diagnoses, having a really good fitting saddle, and getting it rechecked every 6 months to make sure it still fits your horse. We can do things like regular massages, kinesiology taping, MagnaWave treatments, all those different things, often in combination of all of those things, will really help manage the kissing spines and keep your horse comfortable and able to move appropriately. Like I said, good training. Sometimes with the more severe cases, you might go into like shockwave treatment with your vets, or even surgery in severe cases is needed and can be very successful in bringing your horse back to good health. So hopefully this gives you a good overview of what kissing spines are and symptoms that you might look for to have on your radar if you're seeing these things with your horse. Maybe a conversation to have with your vet. And then if you have any questions about how to properly manage something like this, of course you're going to want to start with a plan with your vet. That's step one, to make sure that you are treating it appropriately. But like I said, there are things that we can do to manage it conservatively if it is on the less severe end. And then even body workers can work with your vet through like post-surgical cases and things like that as well, to keep your horse's backs healthy. And again, you're going to want to work with a trainer and make sure that you are riding appropriately and balanced and getting them in a good top-line engagement. So all things to keep in mind with kissing spines. Any questions that you have, please feel free to ask me, comment below. Make sure you like and subscribe to my channel to keep finding out different tips and tricks on keeping your horses happy and healthy. So thank you so much for watching, and enjoy your day.